And with the Medicare debate front and center on the campaign trail in recent days, we'll continue this discussion this morning with Brenda Sulick of the National Committee to Preserve Social Security and Medicare. And Ms. Sulick, first off, do you think what we're seeing now is a debate we're going to see through November, or is all this attention just sort of a short-term reaction to Paul Ryan joining the ticket?
Good morning. Thank you for having me. I think we will see this throughout the election. The polls are showing that jobs and unemployment are still top line issues for folks, but people really are concerned about Medicare. And this is a great opportunity through these elections for people to learn about the system and also what's ahead for them and what these plans that are being proposed really mean.
And tell us about your organization. What is the National Committee to Preserve Social Security and Medicare?
We've been around for 30 years. We were started by Franklin Delano Roosevelt's son. And our whole mission is to protect benefits for our members, seniors. And everything we do is focused on protecting benefits and strengthening the systems. We have over 3.5 million members and supporters from all over the country. We're a nonpartisan organization. So we have about a half are Democrats, 25% are independents, and 25% are Republicans. Our whole job is to educate, and we have a great website that breaks down information for folks to explain things in understandable terms, because these are complex programs.
And why don't you give folks that website?
The website is www.ncpssm.org. It's a tricky one. NCPSSM.org.
Well, talk about the healthcare proposal or the Medicare proposals we're hearing so much about, and what your group thinks is the right way to, as you say, preserve Medicare.
Well, first, I want to talk about the proposal that is being put out there by the Romney-Ryan plan. This is not a modest change. This is a radical departure from what we have in Medicare right now. There's a lot of rhetoric going around, but we really want people to be educated and understand the issues. First of all, this plan would end traditional Medicare. It privatizes the system, and it turns seniors over to deal with insurance companies. And we hear a lot about choice, but it actually would hurt choice in that it would make it harder for seniors to choose their own doctors. Also, it rolls back important benefits that are already in law, such as it would increase cost sharing for preventative benefits and raise prescription drugs costs for seniors. So we do not think it's a good idea.
And what do you think of the President Obama's plan that he's talked about and the proposals that he's put forth?
President Obama appears to be very interested in protecting these programs. Seniors rely on them. They are lifelines. And I think something that a lot of people don't realize is that most seniors are not wealthy. They rely on Medicare and Social Security for their substance to live and for their health care. And we want to make sure they're strong for all generations.
Well, respond to some of the criticisms that Paul Ryan raised yesterday about President Obama's plan for Medicare. Jeffrey Anderson writes about it in this week's edition of the Weekly Standard and lays out some of the same arguments that Ryan was putting forth. He says that Obamacare is going to be a medical and fiscal nightmare and a disaster for our republic, but perhaps its biggest political vulnerability is one that a compliant press corps has so far largely kept under wraps. It is largely funded through a roughly even mix of tax increases and Medicare cuts. Romney and Ryan are already capitalizing on this, and the campaign has released a new ad about it.
There has been a lot of ads about that, and I think how I would respond is when we talk, it's a bit of semantics. Some people say that there's cuts, some say there's savings. The president has not cut benefits through the Affordable Care Act. I think, in my opinion, you're seeing a lot of talk about that from the conservatives, because what we know is that people like the traditional Medicare system. Polls show that Republicans, Democrats, and independents want the programs to stay as they are. And what happens is when you start learning about the details of what the Romney plan is, people don't like it. So there's a lot of focus on other rhetoric. And all I say to folks out there is, you don't have to believe me, but look at the organizations who have been working to protect these benefits for many years. You don't have to listen to the politicians. Organizations like the National Committee, the Center for Medicare Advocacy, the Center for Medicare Rights, go on their websites, learn the issues, and make your decision.
Well, if you want to join in on this conversation this morning on the Washington Journal with Ms. Sulick of the National Committee to Preserve Social Security and Medicare, give us a call on the Republican line. It's 202-737-0002. The Democratic line, it's 202-737-0001. The Independent line is 202-628-0205. We talked about Romney and Ryan releasing their own ad about cuts that they say the president's plan makes to Medicare. I want to play you a response ad from the Obama campaign going after Romney and Ryan on Medicare facts.
I'm Barack Obama, and I approve this message.
Now Mitt Romney's attacking the president on Medicare? The nonpartisan AARP says Obamacare cracks down on Medicare fraud, waste, and abuse and strengthens guaranteed benefits. And the Ryan plan? AARP says it would undermine Medicare and could lead to higher costs for seniors. And experts say Ryan's voucher plan could raise future retirees' costs more than $6,000. Get the facts.
Well, Ms. Sulick, I want to read a little bit more from that Weekly Standard article, another point that Congressman Ryan brought up yesterday. Romney and Ryan, Jeffrey Anderson writes, also point out that no one really knows exactly how much Obamacare will cut from Medicare. Some cuts are left to the discretion of the Independent Payment Advisory Board, a creation of Obamacare. The IPAB will be made up of 15 unelected and largely unaccountable bureaucrats whom the law empowers to cut payments to Medicare providers. Under Obamacare, even Congress cannot overrule the IPAB's decisions with a simple majority vote, thereby making the IPAB constitutionally dubious as well. Talk a little bit about what this board does.
First of all, the comments that you just read don't sound true to me. I've read the law, and this group, which they're calling the IPAB, for Independent Payment Advisory Board, is a group of people that would be appointed to help provide ideas for lowering Medicare spending. But what happens is it's not a done deal. After they will make their recommendations, Congress has the opportunity to look at them, to change them, make other options. If they don't, then the decisions from the IPAB go into place. But what's really important to remember, and there's a lot of misinformation out there, is this IPAB, it says in law, it cannot ration benefits, it cannot increase premiums for seniors. So there's a lot of information out there, and this isn't a board that is kind of like a backstop to kind of help keep Medicare costs within reason and constrained.
Already getting comments from folks on this topic today on Twitter. Stan writes in about one of your earlier comments. He says, your guest says the president wants to protect Medicare. Then why did his health care plan take $716 billion out of Medicare?
Hi, good morning. First, I would say that's a false claim. If you look at the law, it did not take, the Affordable Care Act did not take 1 cent out of guaranteed Medicare benefits. What it did is it put into place some different ways to strengthen the program. We've seen already it has strengthened the program by about 8 years by doing some things that are smarter in terms of making healthcare more efficient, such as coordinating care. Especially seniors may have several doctors or taking a lot of medications. Having somebody who coordinates that so we don't duplicate efforts and do things that may hurt the person and cost more money.
Let's get a few calls on this subject. Eugene is waiting on the Republican line from Jackson, Michigan this morning. Eugene, thanks for calling in.
Yes, sir.
Are you from Mississippi? Sorry about that.
Michigan.
Oh, from Michigan, okay.
Thanks for taking the call. And just a few comments about Social Security and Medicare. In 2010 and 2011, there was no cost of living, and that money has taken away $6 billion a year from Social Security forever. And they say there's 10,000 people a day joining Social Security from the baby boomers. Well, by 2025, that will cease. All the baby boomers will be involved in it, and after that, then they'll be going away, and there'll be 10,000 less per day on Social Security, and by 2030 there'll be 15,000 a day less than Social Security. And if it's privatized, where is the money coming from to pay the people that run the privatizations? Leave it like it is. It's worked good for 85 years, and if they didn't steal from Social Security, there would be no problem with it. And by the year 2030, there'll be no problem with it. Thanks very much.
Thank you very much. I appreciate that comment because I think the caller is exactly right. The baby boomers are not going to be here forever. And the way the system works is the trust fund for Social Security is being spent down in a way we know that they were coming. Changes were made in the 80s to accommodate for this. So the system's doing exactly what it has planned to do, it is supposed to do. And if the system is privatized, it can be very scary for seniors. You could run out of money. Social Security provides a guaranteed benefit that you can't outlive. And we agree. We think the program should stay as they are. They might need some modest changes, but we don't need to destroy them or dismantle them.
I want to point to a headline from, this is an Associated Press report, Social Security not the deal it once was for workers. People retiring today are part of the first generation of workers who have paid more in Social Security taxes during their careers than they will receive in benefits after they retire. It's a historic shift that will only get worse for future retirees, according to an analysis by the Associated Press. Talk a little bit about this Social Security deal and whether this is have to be a fact of life for people, that the deal is not as good as it once was.
I think Social Security is a good deal for current generations and for future generations. And, you know, think about it. It's social insurance. Some people are going to need the benefits. Some people aren't. What a lot of people forget is that Social Security is really a family-based program. It's not just retirement benefits. It has a benefits for survivors if you're a widow or a widower. It has benefits if you're on disability. I have several friends whose parents have died when they were young, and if it wasn't for the benefits helping them, I don't know how they would have gotten along. So we have to think about all the pieces of the program.
We'll go now to Beverly on the independent line from Hartford, North Carolina. Beverly, thanks for calling in.
Hi. Yeah, I agree with the young lady who's sitting there. The Republicans, I mean, people, all they have to do is look at all of this money that's coming into their program. I mean, billionaires don't help little people. And Obama's trying to get the fraud out of Medicare. That's where the money, the $700 and something billion is coming from. If you go into a hospital and you see the lights that are on for no reason, people using telephones for no, we're paying for that. That's fraud. And as far as Romney and his running mate is concerned, they ran on one promise, and now that they see that things aren't working right, they're jumping the gun. They're totally dishonest, and I would never vote for them. Thank you.
Thank you for your comment. I just want to add that you're right. One of the areas when they talk about these cuts to the Obamacare, what this comes from are actually savings. And it's a greater focus on waste, fraud, and abuse. In the last couple of years, since the law's been in place, I've seen estimates between $5 and $10 billion that have been recovered to the system for Medicare. Also, overpayments to insurance companies. That's another area that the law looks at. So I agree, and thank you for your comment.
We've been talking a lot this morning about Paul Ryan's visit in Florida yesterday at a retirement community down there. I want to play a little bit more from that and then get your reaction.
Our plan does not affect the benefits for people who are in or near retirement. It's a promise that was made, and it's a promise that must be kept. But in order to make sure we can guarantee that promise for my mom's generation, for those baby boomers who are retiring every day, we must reform it for my generation. To save it for this generation, you have to reform it for my generation so it doesn't go bankrupt when we want to retire. The good news is there are bipartisan solutions to do this. The plan we support originated in the Clinton Commission plan to save Medicare in the late 1990s. It's a bipartisan plan in Congress today. It's a plan that says, do not change benefits for people 55 and above, and for those of us who are younger, when we become Medicare eligible, we get a choice of guaranteed coverage options, guaranteed affordability, including traditional Medicare. So we get to pick the plan for us when we retire, and that means all those providers compete against each other for our business, and we don't have to beg for the mercy of 15 bureaucrats whether or not we get our health care.
Ms. Sulick, wanted to get your thoughts on it.
I have many comments about that. There were a number of claims made. First, we keep hearing that the Ryan budget will not affect people 55 and older. It's for people younger than that. First of all, that's false. Look at what the plan would do. It would roll back changes that are in law now for people who are getting preventative benefits. They don't have to pay the co-pays. They're getting a free wellness visit, and it lowers prescription drugs costs. Also, when we hear again about this idea of choice, it really benefits the insurance companies. There may be more insurance companies, but seniors will have less choice with their doctors. And I just want to add one more thing with this bipartisan claim. There was one Democrat, Senator Wyden, who worked with Representative Ryan on his first plan. And I don't know of any other Democrats that have signed on to the plan. And now in the next version of the Ryan plan, even Senator Wyden is saying that's too many cuts for seniors. I don't agree with that. So I keep hearing that, but I think when you think about, okay, there's 100 senators, there's 435 people in Congress, and then you have one who looked at an older plan. To me, that doesn't really sound that bipartisan.
But what about his claims that it stemmed from a Clinton-era proposal?
There has been talk about premium support for 15 years. But I think, again, the bottom line is it hasn't gone through or gotten very far because what it does is it ends traditional Medicare, it privatizes the system, and leaves people to deal with insurers. And people don't want that.
A comment from Fish and Sam on Twitter writes in, how about we end the empire building policing the world and we might have money to do what people need. We'll take a few more calls. Michael's waiting on the Democratic line from Carlisle, Pennsylvania. Good morning, Michael.
Well, good morning, and thank you for taking my call. Reason I'm calling in, instead of changing Medicare as we know it and as we like it, why don't we raise the cap on Social Security and then use a percentage of that to shore up Medicare? Thank you for taking my call.
Thank you for calling in. That's a proposal that our organization, in terms of raising the cap for Social Security, that's something that we look at as a positive area. But we look at that in terms of helping make Social Security solvent for a longer time. But with Medicare, there are other things that we can do to strengthen the program and improve benefits for the beneficiaries without destroying the program and turning it around. There's a number of things. We've already seen that by providing health care delivery in smarter ways, that helps. We could allow the government to negotiate for Part D prices for Medicare. We could encourage more use of generic drugs. There's a lot of things. And the bottom line with all of these, and when we talk about the Ryan plan, is that it doesn't get to the real core problem of what the rising costs are. And that's, you know, there are more seniors coming into the system, that's true. But it doesn't address that the real problem is rising healthcare costs in dealing with insurers. Ryan's plan doesn't do anything to address that. It just cuts benefits.
Want to talk about this as a campaign issue and look to some information put out by the nonprofit Kaiser Family Foundation. The foundation said on Thursday that 73% of respondents polled in the days around the announcement of Ryan on the ticket described Medicare as very important or extremely important to their votes. Future retirees with fixed payments for purchasing private coverage from Medicare. Ryan's proposals has turned the program into providing future retirees with fixed payments for purchasing private coverage or traditional Medicare, arguing that having seniors manage their own health care will help bring down costs. Republicans, as we've said, accused the Obama administration of cutting $716 billion to pay for Obamacare. Talk about this on the campaign trail and what you've seen from the polls.
From what I've seen from the polls consistently is when it comes to Medicare and Social Security, the American public does not want these benefits changed. And that's why I think when you're talking to your elected officials or researching information, look at what the different options really say. And the Ryan plan privatizes Medicare. And I think people do not want that. We have a population where we need to keep our middle class. We want people to get to middle class, and we want them to stay there. Medicare and Social Security were put into place because the private insurance market didn't work. They didn't want folks with a lot of chronic conditions. And before the programs were put in place, we had 35% of older adults in poverty and 50% didn't have any health insurance. And we don't want to go back to that.
Well, as you said, Paul Ryan was in Florida yesterday. John is from Florida on the Republican line, waiting to talk to Brenda Sulick. John, thanks for calling in.
Hi. Yes, just wanted to call in to mention that, when Social Security first began, it was originally intended for poor elderly, not as a retirement system. And at the time, there was 16 workers for every one person collecting. And as we all know, it's going to go down in a few years to 2 to 1. I guess it's right around 3 to 1 now. It's not sustainable. It's an inverted pyramid. And it's the same thing for Medicare. In '65, when they sold it, they said that it would cost X amount of dollars. Well, we all know that it costs have increased exponentially over the years. It's just not sustainable. And the liberal that you have up there, I mean, God bless you, but the bottom line is we have to do something about this. And if we don't face it now, it's going to collapse. Thank you.
Thank you very much. Thank you for the compliment. God bless you. But I would have to disagree with you. When you look, okay, we do want to make sure these programs are solvent for the future for all generations. But look at Social Security. It's not in crisis. It's not in bankrupt. It's not going bankrupt, as you may read about a lot. When you look at the trustees' report, if absolutely nothing is done to the system, it can pay full benefits until 2033. After that, it can pay 75% of benefits. Well, we obviously don't want any type of cut, but with modest adjustments, we could easily resolve that issue. I think it's a matter of priorities in our country.
So do you think Social Security should be a top issue on the campaign trail this year, or you're saying it's not part of this fiscal crisis that we're rapidly approaching?
I don't think Social Security or Medicare should be a part of the deficit reduction debate. These are really important programs. We need time to look at the issues and get real solutions that don't hurt people and not do something that's rash that is going to possibly put some people in poverty.
Let's go to Racine, Wisconsin. Andrea is on the Democratic line. Thanks for calling in, Andrea.
Hi, Brenda.
Hi, good morning.
Good morning. I am so happy, and I'm on your side. People don't understand I work in the health care. And when I call older people and, get them registered for appointments, and they're concerned about their insurance. They're concerned about their Medicare. And me, being a 2-year cancer survivor, I thank God for the Obama plan. I wouldn't be here today. And I just want people to realize when you have older people that want to cancel their appointments because they're not sure they're covered or they don't have enough coverage, like you said, we need to do some little tweaks and we need to find ways. But Medicare needs to stay right now for future generation, whatever tweaks we need to make, we can make them. We're America. We could do anything here. Thank you so much, and that's all I have to say.
Well, I agree with your comment, and seniors are worried, and that's why our organization, the National Committee, really is trying to educate people. People can make up their own decisions. Go to our website, go to other organizations, that this is what we've been doing for many, many years, not just in election years. Look at the data and make your decision from there. But I don't like when I hear that, there's information out there that's scaring seniors unnecessarily.
Well, you talk about educating yourself on this issue. President Obama was in New Hampshire yesterday trying to educate folks on his Medicare plan. Here's a little bit more from that appearance.
My plan saves money in Medicare by cracking down on fraud and waste and insurance company subsidies. And their plan makes seniors pay more so they can give another tax cut to millionaires and billionaires. My plan's already extended the life of Medicare by nearly a decade. Their plan would put Medicare on track to be ended as we know it. It would be an entirely different plan, a plan in which you could not count on health care because it would have to be coming out of your pocket. That's the real difference between our plans on Medicare.
Again, we're with Brenda Sulick of the National Committee to Preserve Social Security and Medicare. Mama Source writes in on Twitter, ask Ms. Sulick how seniors feel about Obama's plan that will result in many providers refusing Medicare patients in the future.
I've heard that before, and people do talk about that, but I look at a lot of the research and the evidence, and right now we just don't see that happening. Medicare there's a lot of people, and it's a big market, and most doctors seem to be taking Medicare clients.
We'll go to Bud on the independent line from Tallahassee, Florida. Bud, thanks for calling in.
Yeah, good morning. Yeah, who's best qualified to improve this Medicare program? If you look at the past performance of both parties, I think you can kind of see the current liberal policies have not worked, and it seems to me that it's time for change. You can't spend more money than you make, and we've been giving money away. The other thing is, I thought Medicare was a trust fund. I don't know how they can take money out of trust fund without the American people, agreeing to do that. But they seem to just take money whenever they choose, and it don't seem right to me. The other thing is your guest speaker there, she seems to be a little bit biased for these liberals. I don't know why, but I think that we need to look at the facts and choose the person that's going to do the best job for us.
Well, Ms. Sulick, you said before your group is a nonpartisan group. If you want to address some of his concerns.
Yes, we are nonpartisan, and we hear from members and our supporters from all different parties. But the one thing we all agree on is that we want to keep these programs strong for future generations. And with all due respect, I think I have to disagree with you in terms of that these programs aren't working. Social Security and Medicare are two of the most successful programs we have had in our country. They have been responsible for getting a lot of people out of poverty, and people that insurance companies did not want to serve in the past. Face it, many seniors tend to have multiple chronic illnesses. It costs the system a lot of money, and sometimes to care for them. With Medicare, you have a guaranteed benefit. You don't have to worry about that. With a private insurance, that's a different mandate. They're a business, and they need to make sure that they're making a profit, which could mean that they will want to choose the healthier people to go in their system, and that won't help the people who really need help.
Well, but I had some questions about funding for Medicare, if you want to take us through that and how funding gets taken away from Medicare.
There are trust funds for Medicare. There's two trust funds. There's they call it the HI, the health insurance, and that is for Part A. And then there's another trust fund, which is the supplemental medical insurance fund. And that's that covers that it's a trust fund that's for Part B and D and also some general revenues. Folks get a small percentage taken out of their checks, their FICA tax for, excuse me, not FICA, for their Medicare tax to pay for future benefits. We have a board of trustees, Medicare trustees, who make projections and recommendations about where the system's going, and people just don't take money out kind of willy-nilly. It is looked at very closely each year by the trustees, and recommendations are made. And I also want to mention, we do need to do some things to strengthen Medicare, but the system has been, in the last couple of years, strengthened and extended 8 years, and the system, it can pay full benefits until 2024, and after that it can still pay hospitals and other providers about 87%. Again, we don't want any cuts, but these programs are not in the bad shape necessarily that you might hear about in the news. Modest changes, but we don't need to destroy them.
Well, since you talked about funding for Medicare, and you are the National Committee to Preserve Social Security and Medicare, can you talk about funding for Social Security?
Sure. Social Security is a trust fund in Social Security, can pay full benefits until 2033. And then after that, if we do nothing, then it still pays 75% of all benefits. So we're not talking about a system. The system is not bankrupt. It's not in crisis. But we do have an area that over time we need to fill to make this program 100% for everyone, because nobody really wants benefit cuts. There's ways that can be done. One caller mentioned possibly raising the cap. How it's funded is that people are taxed up to over $110,000. And after that, you stop getting taxed on your Social Security. Well, we could raise that a little bit, and that could help resolve a big part of the problem.
What did you do before you worked at the National Committee to Preserve Social Security and Medicare?
I've worked in the aging field for about 20 years. I worked a number of organizations. I worked for the Alzheimer's Association. I worked for AARP. I did research at the Institute on Aging at Portland State University, where I did my graduate work. So this is an area that I've really spent my career in, and I believe the National Committee is really looking out for folks, and that's one of the reasons I went there.
We'll go to James now on the Democratic line from Wappingers Falls, New York. Thanks for calling in, James.
Hi, good morning. My name is Jim from Wappingers Falls, New York, and I have a question about the Social Security and Medicare. Right now, I'm receiving Social Security Administration and Medicare Part A, Part B, and Part D, which is a prescription plan. And I have epilepsy, which affects 2.7 million Americans presently. And I'm on VIMPAT, V-I-M-P-A-T, which a Medicare insurance company, which is accepted by Medicare, won't pay for most of the VIMPAT because it's a prescription medication. And out of my Social Security, I'm on Tier 1. I have to pay $208.72 a month for a month's supply of VIMPAT. And after I fall into what they call a gap or a donut hole with the insurance company, I have to pay about $600.99 for a month's supply. And that seems to be too much for an individual like myself to control my seizures. So I don't know what to do at this point. I've tried the insurance companies, and I don't. Would Brenda have any recommendations, or yourself?
Well, I'd have to say I think a lot of people are in similar situations that you are. They have high drug costs. Luckily, through the Affordable Care Act, the donut hole will be closed by 2020. In your case, I would need more information and specifics. But what I suggest is that you can go onto our website. We have a wonderful resource called Ask Mary Jane. Mary Jane is a person who worked for Social Security and on Social Security issues for 30+ years. And you can write into our website, and we can do a little research for you. Our aim is to help educate people and to help them when we can. So please give us a try.
And the website again is?
www.smarjane.org. ncpssm.org.
And viewers can see it there on the screen. We'll go now to Cheryl on the Republican line from Newcastle, Pennsylvania. Thanks for calling in this morning, Cheryl.
Good morning, and thank you for taking my call. Ma'am, I'm listening to you, and I'm very upset. Now, you're telling me and the rest of the country that with the Obamacare, we're going to have choice of doctors. I go to doctors in Pittsburgh. My daughter goes down there because she had a stroke, and we have doctors here in Newcastle. Now, what we're finding is that 82%, and don't tell me this isn't a fact because I know it, 82% of the doctors are giving up their practice because they don't want to deal with Obamacare.
And Cheryl, where are you getting the 82% number?
Be left. Oh, we'll have our choice, all right. But when will we get an appointment? My daughter had to wait for 5 months to get an appointment in Pittsburgh. 5 months. What if you were going to die within that 5 months? That's what's going to happen with the Obamacare.
Well, Cheryl, let's give Brenda Sulick a chance to answer your question.
I'm sorry I upset you with my comments, but I have to say I'm not familiar with the statistic that you mentioned. And that is really frustrating. Under any health plan, I've had that same thing happen to me. Sometimes it takes longer for doctor's appointments. But I would say that under Obamacare, one of the things it does for people that really are sick is it prevents insurance companies from not taking you if you have a pre-existing condition, such as some type of illness. Before that, you would be lucky to get an insurance plan, or you'd pay a very, very high premium. So I have to say, you know, I'm sorry my answers are frustrating, but I just can't agree with that.
Let's go to Stanhope, New Jersey. Hugh's waiting on the independent line. Hugh, go ahead.
Yeah, good morning. Senator Sanders from Vermont is the only politician that I've ever heard come out and specifically say that if the cap was raised from $110,000 to $250,000 a year, it would essentially solve the problem. Are there any other politicians that you could tell us who are also in agreement with Senator Sanders? Because he's the only one that I heard of. Thank you.
Good morning. It's early morning, and none are just coming to mind, but I'm sure there are. I know that Senator Sanders has been an advocate for this issue. He is also one who has tried to get members of Congress to not include Social Security, Medicare, and Medicaid in the deficit debate. And again, raising the cap is one way that could help the solvency of the system. So I don't have an answer specifically to your question, but I hope a lot more people do think about that.
Gene writes in on Twitter, don't we have two Medicares right now, government-run traditional Medicare and a privatized insurance company-run Medicare Advantage?
Good morning. Exactly. We do have that. Right now we have a mixed plan. We have a mixed system. We have traditional Medicare. About 75% of older adults that are on Medicare and seniors and people with disabilities are on traditional. But if there is choice already for seniors, about 25% have chosen Medicare Advantage plans. These are plans that are run by insurance companies. So folks do already have choice in that area if that's what they'd like.
We've got a couple minutes left with Brenda Sulick of the National Committee to Preserve Social Security and Medicare. We'll go to Phil now on the independent line from Summerville, South Carolina.
Morning, Phil.
Good morning, Ms. Sulick. How are you?
I'm doing great.
All right, good.
Thanks for calling in so early and being up with us.
It's a pleasure, and you're not going to like listening to me probably because
that's okay. But I've heard it before. That's okay. Go on.
What I've got here is this. It seems like the one thing you're leaving out is the part about Romney and Ryan eating children. Okay, your nonpartisan perspective on this thing is really something to behold. You know, your connections with the nonpartisan AARP, for instance. You know, I mean, the bottom line is we are spending ourselves into oblivion in this country. Okay, for years and years and years, we've been borrowing more money than we are taking in. Okay, and it's got to stop. If you had been on the line here with me a couple of minutes ago, you'd have heard my grandchild in the background cooing. Okay, we are putting that child into deeper and deeper debt all the time, and people like yourself, all you care about is continuing the status quo as it is right now, and you don't have any regard whatsoever for what's going to happen 20, 30, 40, 50 years down the road.
Well, Phil, got to give Brenda Sulick a chance to respond in the last about minute and a half here we have in this segment.
I'm sorry you feel that way. I am very, very concerned about these issues. I've spent my career working on them. But I want to say I think there are ways to fix these issues and resolve them. Nobody's saying status quo, but we're saying let's not destroy these programs and make radical solutions that haven't been tested that could hurt people. I think Americans would like to see fairness. We would just like to see everyone pay, their share in taxes. I think it's a country where if you've done well in America, you should do well by it, and that means paying your fair share of taxes, and if you're wealthy for that. So we all need to take individual responsibility, but these programs are safety net programs, and sometimes things happen, even when you've saved and did the best you can, and they need to be there for folks when they really are in trouble.
We'll try to fit in Dave on the Democratic line from Sarasota, Florida. Dave, go ahead.
Hi, good morning.
Good morning.
I'm a member of the National Committees, say Social Security, Medicare. But my quick comment, I would like to say that I would like to have them stop raiding the trust funds, and that would help the system go longer. My other concern is they have they tax Social Security benefits after you retire, and they have a cap or a limit where it starts kicking in, and it starts affecting low-income people. I'd like to see if they could get a law passed that would raise the bar so low-income people wouldn't have to be taxed on that.
Brenda Sulick, get your final thoughts here.
Those are some questions that are going to take a little longer to answer, but what I would suggest, and glad that you're a member, contact our office. We are there to help our members and be a resource. You can write into Ask Mary Jane, and we'd like to hear suggestions from folks. We're always open to that, so please contact us, and we'll keep your issues and consideration in mind. So thank you very much.
Brenda Sulick of the National Committee to Preserve Social Security and Medicare. Thanks for joining us. The website is www.ncpssm.com.
Yes, thank you.